many people have a darkening of a skin, especially over the neck area, face and elbows and plenty many body parts. And they always think that this darkening of the skin has happened due to either they are aging or they are exposed to sunlight or if they are not taking a bath properly. Many people also think that because they ride a bike, their skin is exposed to sunlight, that is causing. Some people think it is due to the pollution. Many people think that it is due to friction of the ornaments which they wear in their neck. But is it a right answer? Answer is no. This condition is actually indicating lot of hormonal imbalance. And this kind of a condition is called as Acanthosis Nigricans. Yes, in short form we call it as AN. Now, this Acanthosis Nigricans is a very prevalent problem. What is it? What causes the Acanthosis Nigricans and who are the people more prone to get this problem? That's what we are going to discuss in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now before we continue this video, one important information. If you want to watch this video in Hindi language, then on the I button and below in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप आज के इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic, and that is the Acanthosis Nigricans. Very common skin condition. Either be facing it or you might have seen someone who has this condition. And as I told you earlier, many people think that this is actually not some issue, and they wander here and there to seek their medical opinion. But very few people know that this is actually an internal hormonal issue. Acanthosis nigricans is actually a skin condition wherein your skin becomes darker in shade, darker like a dark brown. If you touch the skin, it has a very soft velvety texture, and this skin is very thick and it is very coarse also. Many of the times, many people besides having this external appearance can also have lot of itching over the acanthosis. Many people also experience some bad odor coming out of it. Few people also have a small skin tags along with it, and many people have lot of itching. So these are all the characteristics of this acanthosis. Though it can happen to any part of the body, however few are the areas in your body where you find acanthosis most commonly. And one such is the back of your neck area. Besides that, it can happen to the forehead and the cheeks area. It can happen to the underarms, over the groin area, over the elbows and to the knuckles of your fingers. Many people also have acanthosis over the knee area and or the sole of their feet or even the palms. Some people can also have it over the soft mucosal lining like the lips and a private area, mucosal area also. So these are the places where the acanthosis is found most commonly. This acanthosis can happen due to many conditions, but broadly they are divided into two parts. The first is the endocrine problem, wherein the issue is there in your body's hormones. Hormonal conditions like type 2 diabetes, then PCOS, which happens to the women, polycystic ovarian syndrome, what we call it as, then a growth hormone abnormality like acromegaly, and a steroidal hormone abnormality like a Cushing syndrome. Besides that, if you have a thyroid imbalance, then also acanthosis is possible. So these are all actually the endocrine health problem. When a person has a acanthosis due to endocrine problem, this acanthosis is usually very gradual in progress. Yes, it does not happen overnight or over a very short period of time. Neither it is spreading too fast. It can happen in other situations wherein it is called as a malignant condition. So if your body has any kind of a tumor or a cancer, cancers like breast cancer in women, prostate cancer in men. Besides that, if you have any digestive system cancer like a liver or a colon or a stomach or a lymphoma, all this kind of a malignant cancer can also lead you into acanthosis. In fact, when you have a malignant region of acanthosis, this acanthosis happens very fast over a short period of time and it progresses very fast. So this is the malignant reasons. Of course, there are certain medications, if you consume, then also you are prone to have acanthosis. Medications like birth control pills, or we call it as oral contraceptive pills, any kind of a steroid medications like a prednisolone, then any kind of a niacin vitamin supplements, all of that can also lead into acanthosis. So these are the causes of acanthosis. Now let's find out why acanthosis actually happens and what is the main reason behind it. So see, the main reason lies in the hormone called as insulin. Insulin is a hormone which comes from your abdomen pancreas gland, which secretes the insulin hormone. It is this insulin hormone which is responsible for maintaining your blood sugar balance. It is this insulin which is important to maintain the metabolism of all the food which you are eating. A right balance of insulin is a very important for your body. If for any reason, if your body either produces large amount of insulin, what we call it as a hyperinsulinemia, or if your body has insulin but it is not working effectively and properly, that is called as a insulin resistance. Both of these conditions, hyperinsulinemia and insulin resistance, both of that can give you acanthosis. Yes, see what happens when the insulin level starts rising in your body. This insulin hormone interferes with another chemical in your body called as IGF-1, that is insulin like growth factor 1. And when you have imbalance of this IGF-1, it causes lot of cell division and cell proliferations over your skin, and that causes large number of keratinocytes and a fibroblast. And that is the reason why your skin is changing its shade and a color and the texture. So the root of this acanthosis lies in the insulin hormone. More the imbalance, more the acanthosis. Alright, so this is the main reason of it. Now let's find out who are the people more prone to get the acanthosis. So the first one is anyone who has a overweight or a higher body weight. If your BMI, body mass index, is higher, that means you are having obesity issues, you will have acanthosis. If you have any of a family member who has acanthosis, again your risk is high. Nowadays, obesity is not only confined to the adult people, it is very common in a young children also. And it is this children, 10-12 years of a young children, also develop a lot of acanthosis. And if you don't treat it on time, it can lead you into a hell lot of problems. What are the problems? How do we treat it? How do we manage it? That's what we are going to discuss in our second video, wherein we are talking all details about it. Alright, I hope after watching this video, you got some good useful information. If yes, please click on the like button. If you are new to my channel, please don't forget to subscribe so that you get more and more health related information. If you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. We'll meet again in our second video wherein we continue our acanthosis treatment. Till then, take care of yourself. Namaste.